patient-ordered testing is available at the hospital's laboratory and the Outpatient Diagnostic Center on 30th Street in Farmington. With nearly 20 tests available, there's an option for everyone. MyLabs, patient-ordered testing, a wellness service of San Juan Regional Medical Center. It's Wednesday morning on KSJE, and you're listening to the Scott Michlin Morning Program. Good morning, everybody, listening at 90.9 FM, and greetings to our viewers who are watching on the KSJE Facebook page and YouTube channel as we stream our program out onto the internet from our visual radio studio here at San Juan College. I'm Scott Michlin. I'm joined in the studio by my guest this morning. Dr. Bob Underwood is here. He is the Chief Medical Officer for San Juan Regional Medical Center here in Farmington. Again, Dr. Underwood, thanks for being here.
You bet. Thanks for having me, Scott.
It's good to have you here to answer some of these questions for us about the changing world of medical care, and it seems like every day there's a new story in the news about some new proposed legislation or some new differences in what's going on in Europe and what's going on over here, and
sure,
why can't we do what Canada does, or what have you. So
yeah,
it's an ongoing and evolving conversation.
Yeah, it's constantly ongoing. The government, there's a lot of pushback, I think, from healthcare, from what the government is trying to do. But if you look at their motivations, I think that the motivations are appropriate, and that is to reduce the overall cost of healthcare. Healthcare has what they call the triple aim. And in the triple aim, we're trying to improve the experience of healthcare for an individual, improve outcomes, and decrease the overall cost. And so if you really look at that, that's a value proposition, value typically being quality. And so if we can reduce cost and keep quality the same, then value goes up. If we can improve quality and keep costs the same, value goes up. But overall, it's really driven around the value of healthcare.
Interesting. And so, but a lot of folks will say we have very expensive healthcare in this country compared to maybe other countries. Is that just because of the system that we're working within?
Part of it, of course, it's always multifactorial. Mm-hmm. Some of it is just the history of the way healthcare has evolved and the financial realm of healthcare, insurance companies, etc. Those are some differences. The other is there are multiple things that build into what you normally will see is the cost of healthcare balanced against what is our quality. And that quality component is the piece that is actually multifactorial. They look at healthcare and say, well, your outcomes aren't as good, but it's really expensive. But then you got to play in genetics, education, finance. All of these things play into healthy lifestyles, healthy lifestyle choices of patients. Those are factored in some of the other countries that we look at, and they have a more active or proactive approach to some of those areas, more so than the United States may. When we look at our cost of healthcare, we're just talking about the cost of medical care. We're trying to, I think in the U.S., move farther away from medical, more towards health. And a lot of that is preventive, as we spoke in the previous segment.
Right, exactly right. And I guess the other question would be, in other countries, is the quality that consistent for everybody, or is it quality for those who can afford it and not so much for those who cannot, even if everybody's covered in some capacity?
Yeah, that's correct, and it depends on how you look at it. Generally speaking, if I were to have an emergency medical condition, I would not want to be anywhere other than the United States.
Any other country?
Any other country. I would much rather be in the United States. When I was in grad school, we looked at the Japanese, the German, the British, and the Canadian system side by side with the U.S. system. And overall, I wouldn't want to be anywhere else. Again, I said if I had an emergency condition, sure, there's just no place better to be. But that's one of the things that is part of that evolution of our healthcare system, is that we're really good at rescue medicine, not so good at the chronic disease management, at the preventive stuff that we were talking about earlier.
Right.
Yes, other people in other countries can afford it. Different tax structure, different payer base. And so that is very much different than the United States in the way that our systems have developed over time, with private insurance, self-pay, Medicare, Medicaid, all playing into that cost mix,
right,
if you will.
And I don't want to make this into a political program, but I do want to ask you about the Affordable Care Act, because that is the first, I think, most major change to health care in generations.
Right.
And it has been looked at by government officials as maybe tweaking it, getting rid of it, putting something else in there, or what have you, but it's still there, and that is still the law of the land, and that's what the rules everyone's playing by at the moment.
Yeah.
Has it been a good thing as far as San Juan Regional Medical Center is concerned to have this available to everyone? And it seems like folks are taking advantage of it, maybe more than they were. They couldn't afford care before, maybe now that they can, some families.
That's true. There were certain, especially with Medicaid expansion,
which New Mexico is done.
Right. Same in Colorado, where I came from. I also worked in Virginia prior to that, and Virginia chose not to expand Medicaid. So that certainly provided a broader population base that could afford to come get health care. Some other things that happened is some employers said, well, you're qualified for Medicaid now, so they stopped providing private insurance for their employees. So there's been a mix in terms of how people have perceived it. Overall, initially for hospitals, it was a really good thing because there were patients that we were taking care of anyway who were not in any payer mix. They were self-pay, and that often meant that it was going out as charity care. But now they're in the payer mix, so we're at least getting some revenue, even though it's not enough to cover the care that's provided when it comes to Medicaid, generally speaking.
I see. More than you were getting before.
It's more than we were getting before, but now those Medicaid numbers have actually expanded too, which means we have more people that have moved off of private insurance, which was better for the hospital in terms of revenue, down to Medicaid. And so that's been it's been an interesting balance in trying to keep up with the revenue stream based on all of these changes because they're happening so fast. It's been really interesting and fun to predict. Interesting is a good word. Fun to predict. I don't know if everyone would agree with you. Yeah, maybe not. You know, there's reasons some of us chose to go into administration, and that's because we like this sort of thing. Right. Well, there you are. Well, that's never a dull moment, I guess, is what we can say. Absolutely never a dull moment. And, you know, in the end, what we're really trying to do is provide the best care for the patients in our community. Sure. And so trying to predict how do we do that and still maintain the appropriate financial position for the organization so we can keep doing that, so we can continue to fulfill our mission as an organization. That's always been the fun balance. Right. Well, and there have been some stories that I've seen in the media about maybe community hospitals or other hospitals in some more economically disadvantaged communities shutting their doors because of some of the changes. And I don't know the exact cause, but I can only assume it's because of some of the changes in this payer mix, and the profitability maybe just isn't there anymore like it once was. Is that reasonable? I think that that's a reasonable statement, yes. It depends on the community. Right. But yeah, that's something that has definitely happened. And that leaves those communities then without a hospital, or maybe they had a couple in their community and the other one can pick up the slack or whatever, but for others it may be a commute to get emergency care or medical care. Yeah, that is absolutely true. It does depend on the community. Yeah. Some of these facilities are in larger cities, and yes, then there's alternatives. Unfortunately, I've also read about in a couple of journals some hospitals where they were the sole community provider, and that's really bad for that community. Right. That's unfortunate to see. It is. In any event. It is. But our hospital is healthy. We are. And stable and is weathering whatever the uncertain seas are out there in the healthcare world. Would that be a fair analogy? I would say that that's a fair analogy, and we're always trying to predict what's going to come next, right. Whether it's from the federal government, state government. So we're, especially Jeff, he's our CEO, he's very actively communicating with those forces to try to understand how it's going to position our facility as we go forward. And we talked about things at the federal level, but there's also changes sometimes at the state level too that can complicate things, or just maybe I'm trying to remember. I think maybe a sales tax bill on nonprofit hospitals or something like that. If I'm remembering, right? Yeah, there's been discussion about that, and so
That would be a significant impact to your bottom line,
That
right?
would be a huge impact to our organization. And so we look at most not-for-profit organizations have some tax advantages, but there are certain parameters where you maintain your tax-free status. And we work very hard to make sure that we're doing those things for the community. And usually that's what it is. It's doing outreach for the community, providing community services that otherwise would be unmet if the hospital weren't doing them. And usually we do those without charging for those services.
Healthcare is often touted as a way, in healthcare services, a way for economic diversity for the community, and something that people look towards San Juan Regional Medical Center to maybe provide some of that economic growth as we look to diversify the economy of Farmington and San Juan County. And it seems like the hospital has stepped up and continues to be a very active partner in some of these efforts, some of the improvements and increases in cardiology services and the other services that you and the hospital provides to the community.
Yeah, absolutely. We bring people in from outside. Obviously, physicians are the ones that typically stand out. You know, there's not a medical school here, and so we have to bring our physicians in from other areas. There are several physicians who work in the community who were born and raised. They went away, they went to college, they went to med school, and they came back because they wanted to serve our community, and I think that's great. But we have a lot of physicians also who came from outside of this community, bringing those services in. And of course, that brings diversity. The other thing that is, of course, has a big impact is we recently did a little bit of a restructure around our information technology at the hospital, which is going to also bring in some employees from outside of our community to provide high-end technical support around our healthcare.
You're talking about switching over to another system, I guess, right? That will help maybe coordinate all of the information that the hospital generates about a patient, about a procedure?
Correct. And so we're moving. We actually currently, and this is unusual, so this is something that's bringing San Juan Regional Medical Center kind of into the modern age around healthcare IT. But we're moving from essentially 5 different platforms of information technology for patient care to a single platform. That's going to be a big benefit for the patients within our community. Overall, Cerner is the name of the company. Worldwide, they're actually the largest IT healthcare provider. In the United States, they're number 2, but they have platforms that have been rolled out all over Europe, et cetera.
Interesting.
Yeah.
I'm thinking about it, and I can only maybe describe it to our listeners and viewers this morning as maybe working on a Windows machine halfway through your project and then having to switch over and finish it on an Apple machine. But then it's 5 other computers part of that too.
That's an accurate statement because it's all software driven.
Right.
And so,
but a whole different way of entering data maybe, and other
different
things,
way that data is kept, and also the different ways that data is shared. One of the analogies I like to give is if I have a patient, for example, who's having an asthma attack, and they go in to see their regular physician that's part of San Juan Health Partners, which are our employed physician group. Then they come in, they may get a dose of steroids and an albuterol inhaler, but they seem like they're getting better and they're sent home. But then later that night, they seem like they're getting worse, so they come to the emergency department. So now the patients in the emergency department, they're on a different IT platform. And the IT platform in the emergency department doesn't talk to the one in the offices right now. So the physician in the emergency department can't necessarily see exactly what happened earlier in that day. Then, if they get worse still and end up having to be admitted to the hospital, they get admitted to the inpatient floor of the hospital, and that IT platform doesn't talk to the ER and doesn't talk to the office system. With what we're employing, that'll be one system, and all 3 of those visits will all show up together.
Interesting, because in that scenario, at least the patient is conscious and they can tell you what's been going on. But if someone comes in who isn't, then you're kind of guessing or stuck.
Well, you're kind of stuck. We have methodologies around that. I'm an emergency physician by training.
I see.
But yes, absolutely, we're at a significant disadvantage. And the other component of that is that we can find that information or find ways to do it, but it takes time.
Right.
And sometimes, especially in the emergency department, time is not exactly a luxury you have.
And with this new system, I guess that the information would be almost instantaneous, I guess, when the patient presents.
Correct. It would all be on a common platform. I can go to the patient's medication list, and all of that information will be immediately available to me in the air.
Interesting. Anyone familiar with software probably knows this is not a cheap endeavor.
No. It is not at all.
And takes a while to implement. If you're talking about a major medical facility with 175 doctors and I don't know how many computer terminals in the building.
Yeah, hundreds of computer terminals, and of course every employee of the hospital has to be trained up on the new system. So, we're talking nurses, respiratory therapists, radiology techs, physical therapists. Everybody has to learn how this new system works. Registration in the waiting area of the hospital. All of those people have to be trained on this new system. And so it's across the board. And then physicians too, and physicians taking their valuable time to learn how to use the system because they know in the long run they've got to learn how to get a patient through that system and get the information in that's very, very valuable. The other thing that's going to be really great about this new system is it gives us the patient outcome data immediately at hand. Currently, like I said, if we have 3 different systems and we're trying to pull out what are our patient outcome data and how do we go about a systematic improvement of the way we provide care at the hospital, which is what every other industry does, and healthcare is new to the game in that. But having a good IT platform that helps us generate what are those outcome data, how do I look at how my patients fared, how much did it cost to do that? That's really where healthcare is starting to go, and that gets all the way back to the Affordable Care Act that we were talking about before, insurance, payer groups, etc. Without a good information system, it's really hard to drive that improvement the way we need to do it.
Interesting. Just a couple of minutes remaining this morning,
Sure.
Dr. Underwood, and I want to ask you a bit about when folks maybe get frustrated with medical care. Maybe not the hospital, maybe not their doctor, but maybe the insurance company or maybe something else. But they have this problem and they want to come and they can't get it taken care of until they get an okay from whoever's going to pay the bill, and
Right.
then they can go forward with that, or maybe there's a misunderstanding or who knows. But it's got to be frustrating all the way around for not just your physicians, but the patients too.
Yeah, absolutely. It is a navigation at best. And I have to say that I was recently a patient, and I had frustrations with trying to get pre-approval, and I know the system. And so if I know how these things generally work, I know how frustrated it is to somebody who's not part of that. So one of the things that some insurance company have is a navigator to help you through that system.
Right.
Not all do, but that can be very, very beneficial. We have that in our hospital in some service lines, which is also beneficial. A joint replacement, which we talked about before,
Right.
for example, has a coordinator that'll help navigate somebody through that system.
That can be very helpful, I'm sure.
It can be very helpful. And there are some organizations that are working hard, not only for that navigator to help with the system around payment, but also health coaches that help patients understand when they're supposed to be taking their medications, making sure they make it to their follow-up appointments, etc. Some of the big organizations are doing that. We're talking about Cleveland Clinic,
Right.
Mayo Clinic, etc. But they're on the cutting edge of how do we change this healthcare delivery model to make it more understandable, more feasible for the patients to understand really what's going on with their own healthcare.
Right. Final minutes this morning, and the new story, there's a new hospital that opened in Santa Fe. Folks were comparing it to a hotel more than a hospital. You mentioned that you have the most expensive rates for overnight stays in the,
Right.
in the county.
Right.
But it seems like hospitals are turning more into nicer appearing buildings. San Juan Regional has won an award
Sure.
for the appearance of its building, and all that is part of the healing process, to be surrounded by garden areas and a hospital room, that doesn't look like a hospital room. All that, I think, has been studied. It can be advantageous for a patient.
You bet it really is. And that was one of the things that appealed to me the first time I toured this hospital as well. There's balconies in some of the patient rooms. We have meditation rooms on all of the
Right.
floors. Yes, they are very, very beneficial to the patient. Remember when I talked about the triple aim, that one of the one of the points of the triangle and the triple aim is to improve the experience of care for the individual patient. And I think that that's all part of that. It gives the patient a sense of well-being as they're having to navigate what is often a difficult part of their life. To be part of the healthcare system. I'm part of a healthcare system by choice. Most patients aren't.
Right. Well, that's true.
Yeah.
But they certainly, I think, appreciate the time that they're at the hospital, or maybe in hindsight they can appreciate the time that they were at the hospital if they really want to get home. But having those surroundings that are a bit more maybe beneficial is certainly part of the process.
Sure. That and the overall experience of care, we as other organizations across the country are really working to try to improve that as well. The patient's interaction with the staff members, with their physicians, with their nurses, with their respiratory therapists, with their physical therapists while they're in the hospital, to make that experience the best experience that it can be for the patients. And we're working hard to try to drive that improvement, and that's always a constant. We survey patients, we survey staff members, looking at where are opportunities for that improvement.
Very good. Dr. Underwood, we're out of time this morning, but I appreciate you being here.
You bet. It's been very enjoyable, Scott. Thank you.
Thank you for coming in. Dr. Bob Underwood, he is the Chief Medical Officer with San Juan Regional Medical Center here in Farmington, my guest on KSJE. This program on KSJE is supported by Citizens Trust and Investment Corporation, providing a competent, innovative... It's Wednesday morning on KSJE, and it's time for our weekly trip to the Encouragement Lab with Communications Professor Dr. Mike Hadaba, who is joining us on Skype this morning. Dr. Hadaba, good morning.
Good morning, Scott. How you doing?
I am well, thank you. There are your goggles and everything. Wow, things are hopping in the lab.
Working hard.
Okay, so today our topic is overcoming our negative culture. Do we really have to do that today?
Well, if you want to be happy, you do.
Yeah, okay.
That's it.
All
if
right.
you want to be miserable like everybody else, go ahead. But so I ran into somebody. I had a great talk with somebody that's kind of a student of our culture. And he introduced me to a concept, and I'll have to ask him what the book was, but I've seen it other places. But the idea is that now that we've crossed the millennial boundary of 2000, and we've had a decade of that, by now we're starting to realize that, you know what, the new era is not the end-all, the be-all, end-all. It's not going to solve all of our problems. And so because of that, our culture is beginning to kind of fall apart. And we're beginning to find blame and criticism of everything and everybody. And you just have to watch a little bit of the political scene to run into that.
There's a lot of negativity.
So I talked about how do you deal with that as a human being and how do you overcome that when you're just literally bombarded by it on a moment-by-moment basis.
All right, sounds good. We only have a little bit of time this morning, Dr. Hadaba, so my apologies, but give us the condensed version of how we can fix this or deal with it.
All right, so here's the deal. So first of all, control your access to negative information. So a lot of us are getting up in the morning and we're jumping on and we're watching, news programs that are just hypercritical or political, or we're jumping on Facebook and scrolling through all this information. And even information that seems positive, like, oh, look how my friend's doing this. Realize that we only post positive stuff on social media. So everybody on social media looks like they're doing better than us. And yet, when you look behind the scenes, we're all, as a statistical measure, not doing as well. And what we're finding is that constantly being bombarded by that kind of false positive information is actually giving us a negative vibe. And so what I say is protect yourself for the first couple hours when you wake up. Listen to a truly positive program like KSJE, where maybe they're talking about the tough issues of the day, but it's always done in this gentle, positive-centered mindset. And then what will happen is then your mindset will be set to be positive. When you have to go to your job or deal with what's really going on in the world, you'll have already kind of set your mindset to be positive, and it won't impact you as much as it is as if you start out your day with just this constant negative cycle. So there's not a lot you can do to avoid it completely, but you can avoid it a little bit in the mornings, and then also I suggest avoiding it a little bit at night before you go to bed. And that'll help reset who you are and just give you that little edge of becoming a more positive person.
Right. It seems like good advice, Dr. Hadabon. I think we'd be amazed to see just how that slight change of trying to avoid some of that negativity can really affect our overall outlook on life. Don't you agree?
Sometimes, you have to hit that unfollow button on social media, too.
Right.
You've got that friend that's just constantly posting that negative, information. If it makes your blood boil, then you probably shouldn't be looking at it as much as you are. So,
very true.
So let it go, because most of that stuff you can't do much about anyway, so why get angry about it? So
good advice.
That's what kind of amazes me, is I know people that are literally, their entire day is about, the Supreme Court nomination on both sides, and I'm going, your opinion, your emotional feeling about that's not going to change the outcome.
That's true.
People in Washington are, and it may be for your side, it may be for the other side, but realize if you can't change it, you're spending emotional energy on something that isn't going to directly, you're not going to be part of that decision.
That's very true.
You some of the outcomes, but if it's not part of your decision, then you're worrying about something that's out of your control.
All right.
And that is what's so unhealthy.
Okay. Dr. Hadabon, thank you so much.
You're welcome.
We will catch up with you again next week here in the Encouragement Lab. That's Dr. Mike Hadabon joining us via Skype this morning. Thank you so much. And this is KSJE, Farmington, New Mexico.